Hey everybody. Where do I start? I think my last video was about my dumping syndrome, which was really fun, but after that I haven't had any issues, thank goodness. I hope you guys are doing good, and thanks for tuning in on this journey. I've had a pretty uneventful week. I went back to work almost a week ago tomorrow. Today I'm exactly 3 weeks out from surgery and I'm doing really well. I saw my PCP yesterday just for some refills and things, and she was really thrilled about the amount of weight that I've lost and that I'm doing so well. But you guys can see it is summertime in Texas and I think my air is on like 72 and I am freezing, so that tells me that I've got some iron deficiency going on, because I'm usually the one that's burning up and sweating, and I used to keep my air on 68 or 69 constantly, and now it's up to 72 or 73 and I'm still freezing with a blanket over on my lap. I'm wearing a zip-up sweatshirt, so I think I have some iron issues. But she did some blood work yesterday to pull it. I'm curious to see what my B12 looks like and my B1, using the nasal spray that my surgeon, Dr. Chad Carlton, gave me. I've had prescription vitamin D at 50,000 IUs because I work from home. I don't get a lot of sunlight during the workday, and it can be an 8, 10, or 12-hour day depending on how busy we are as a nurse. Working from home, which is kind of nice, but my vitamin D is low, which affects depression. So make sure that you're taking your supplements. Started my vitamins last week. The day after my 2-week checkup, I was able to start those, and I am taking the 4 a day, but I am not spacing them out. I'm taking 2 in the morning after I get food in my stomach. It's really important for you to either drink some milk or drink your smoothie first before you take the vitamins, because it can irritate your stomach. You should have an acid reducer probably that your surgeon is giving you for your stomach. I have to take it every day, because even before I had the surgery, I would keep it in my purse and take it before I would have a margarita or any kind of fruit juice or anything. So I know that that's helping, but I definitely know that I've got an iron deficiency, and I won't be shocked when they call me by the end of the week this week to let me know that I probably need to take some iron, which causes even more constipation. So I see my pain doc on Thursday, and I'm gonna ask him to prescribe something for me, because I'm still, getting my liquids in, and I take pain medication for my back injury, which I will hopefully not have to take anymore after this weight comes off in the next year. And just about everything that could possibly stop me up is happening in my life. So I have to be really cognizant of that. I had a really hard afternoon yesterday. Just constipation is miserable, and milk of magnesia, just plain old generic milk of magnesia from CVS, knocks that out for me. So I also bought some combination stool softeners / laxatives today to try and get everything to regularly move, and I'll start adding that with my vitamins and my biotin and taking that every day. I've noticed my skin's a little drier, and I've noticed a little bit of crepiness underneath my eyes, and I have a feeling that's probably because I'm not as hydrated as I should be. I do my best. I keep the circle that I've showed you guys before with the cartridges with me all the time, so I always have water with me, but when I'm on a call for an hour and I'm talking, it's just super hard to sip. So I'm working on it. We're all a work in progress, and I think we have to remind ourselves of that. Super important to remember that we're not going to be perfect, and we've got to figure out what works best for us during the course of this journey. So other than the PCP visit and another doctor's appointment this week, I'm doing really well. I'm tolerating everything really well. Haven't had any more dumping issues after Friday night. That was awful. I won't ever get to the point that I overfill again. And alcohol, not a good idea. Saturday I had a party to go to, and I'm not supposed to be drinking alcohol for 3 months, and I had a tiny bit of vodka in a very large glass of water, and yeah, you know right away that you're not supposed to have any of that. It just converts to sugar, and you'll feel it right away. I didn't have dumping syndrome or anything like that from it, but I just pushed the drink away and didn't drink it. So yeah, going to parties right now or doing things with friends and not being able to have a glass of wine is challenging, but I'm 3 weeks out. Next week will be a month, and then I only have 2 months to go before I could maybe have a glass of wine with dinner. Got a few more weeks to go. I'm really trying to watch the weight that I'm carrying to make sure that I don't do any damage to my staples or anything like that. Even 3 weeks out, it's really important for you not to lift and to follow the instructions of your surgeon so that you don't do damage that could land you in the hospital or land you with having another surgery. So that's really important. But overall, I'm feeling really good. My energy is incredible. I don't know if it's a combination of the once a week vitamin B shot, or if it's really my the weight that's coming off that's making me feel really good. But I do, and I'm super energetic. One thing I was gonna say is yesterday, I haven't taken my blood pressure medication in a while, because when you take blood pressure medication, a lot of the time you have edema or swelling in your hands and your feet, and then what they prescribe along with the blood pressure medication, in my case it's Toprol, they will give you Lasix or furosemide. It's it's basically a water pill to get the edema, the water weight off of you, and you have to take potassium, which is essentially salt, along with it, because your body's losing water. Well, I can't afford to lose any water right now with constipation and this surgery. We have to stay hydrated. It's really important. So I haven't been taking my blood pressure medication or my Lasix or my potassium, and actually since surgery I haven't taken it. And yesterday at my PCP's office, my blood pressure was completely normal. I want to say it was like 110/76. My blood pressure hasn't been normal in probably 10 to 15 years. So while I don't have a lot of scale victory going on right now with the weight loss and the pounds, I can tell you that I've got the size and the loose fitting clothes, a lot of non-scale victories. My blood pressure seems to be under control. So to me, that's much better than counting the pounds on the scale. So pretty exciting. So I hope you guys are having a good week. I'll try to post again another video over the weekend, let you guys know how I'm doing. I bought a new car this weekend and pretty excited about that. Got my dream car over the weekend. My daughter turned 16 on Friday, and I gave her my Camaro, so she has her car now and I have mine. So lots of changes, lots of I've got a reward system in place. I think I'm going to be paying for that reward system from Saturday for a long time, but I think it's important for us to reward ourselves for doing such a good job with the surgery and following the rules, and as much as possible, I feel like I'm your guinea pig and I'm doing the things that I know I'm not supposed to do so that I can make a video and tell you, don't do it, guys. I feel like I'm throwing myself out there as the VSG guinea pig, but I just hope you guys have a great week. Subscribe below, turn your notifications on so you'll know when I post a video. I try to do it every couple of days, every 2-3 days, but just keep in mind I've just been back to work a week tomorrow and I have been completely swamped. So I'll try to post again this weekend. You guys have a great evening, and thanks again for tuning into my channel.